this patient came to see me for endodontic treatment of tooth number 3. There's a porcelain crown, as you can see, on the tooth, a block of concrete, and a large periapical lucency associated with the palatal root and to some extent MB root. So take a look. There was also a buccal swelling associated with the tooth as well. Right here, that's the tooth right there. You can see the buccal swelling right there. Very tender to percussion and palpation. Probings were 2 to 3 millimeters all around. And again, went over the radiographs. You saw that there was basically really no visible on the radiograph canals. There's another angulation of the tooth, and again you can see this patient had a very small mouth, very tiny mouth, and she was 80 years old. So very anxious as well. We talked about root canal with a variegated prognosis due to, of course, calcification and a large periapical lucency. You can see here, another one here, and let the patient know I may not even be able to do the root canal. So, you know, we can try if you want, see what happens, or the alternative would be extraction. And patient said that she was on antibiotics and she wanted to give things another day or two and then she'll decide what she wanted to do. Then she left. She called my office and said she wanted to schedule, but she wanted to schedule for IV sedation because of her dental phobia, dental anxiety. I said, okay. Then that's fine. We put her down for IV sedation per her request. I didn't even offer her IV sedation. Upper teeth, I can get them profound anesthesia, local anesthetic. But this patient, she called herself and she wanted IV sedation, so we put her on schedule for IV sedation. Then her dentist called and said she doesn't want to do IV sedation. Can you do it without? I'm like, I didn't even offer IV sedation to her. She left and she came back. She left and she called later and wanted to be IV sedated herself. And her dentist laughed and said, yeah, that's fine. And then the patient called and said that she wanted to be given oral anxiolytic. So I said, fine. So we gave her a prescription for oral anxiolytics, just something to take the edge off, Ativan, Valium, something like that. And she came in today, and she came in with her partner, and because when we put them on something like Ativan or Valium or something like that, they cannot drive themselves, or when we dismiss them, they cannot drive back home themselves. So these patients need to have a ride. So we always make sure of that. So she came in with her ride, and she said she was feeling very well and she wanted to talk to me. I said, fine, what's going on? She said, well, I went to another endodontist and he wanted to take a CBCT, and he told me that this case was extremely challenging and difficult and he needed a CBCT. Why didn't you ask for a CBCT? Why didn't you get a CBCT? And I told the patient, I said, endodontist to endodontist is different. I don't need a CBCT for this case. A couple of PAs that we already took would suffice for me. If you want to get a CBCT, order a CBCT, you might as well go see the other endodontist. And the patient said, no, I've researched you and you're the best, and I want the best, so that's why I came back to you. I said, okay, very good. Yeah, I don't need a CBCT. If somebody else wants to get a CBCT, more power to them. Anyways, patient finally, we had the consent signed and we went ahead and got started. As I said, anxious patient, we put her on oral anxiolytic. We could barely fit a child-sized bite block in her mouth, but she fell asleep from the start of the RCT to the end. She took a nice nap and didn't even wake up once. Anyways, went through the porcelain crown, limited, as I said, very limited opening. Went through the porcelain crown and complete calcification. No pulp chamber, of course, didn't expect that. Found a little dot on the distal buccal, went in with an OHC file, and lo and behold, found the distal buccal canal first. Once I found the distal buccal canal, then I triangulated and found the palatal canal. And once I found the palatal canal, I went to the mesiobuccal and started troughing with ultrasonics. I used the Ultramin Pro by 8 Teeth, loved that ultrasonic unit, and located the MB2. Once I located the MB2, then I troughed towards the buccal and found the MB1. And altogether, 4 canal systems, and from start to finish, it took us about maybe 45 minutes. No CBCT. Take a look. Here's the post-op. MB1, MB2 start as 2 separate canals, then they join mid-root. They join. Distal buccal. Look at the palatal there, and look at that beautiful, beautiful bifurcation. or lateral canal in the apical area of the palatal canal there. And you can see that large periapical lucency associated with the palatal root. Another angulation where you can see the palatal root, and you can see that beautiful lateral canal there, and you can see the large periapical lucency. Again, another angulation here. You can see MB1, MB2, distal buccal palatal, beautiful lateral right there. All right, so as you can see, everything went beautifully. Went ahead and temporized the tooth and referred the patient back to her dentist for the permanent restoration. As I said, this from start to finish took us about 45 minutes. No pulp chamber, dental anxiety on oral anxiolytic med, and limited opening, 80 years old. No CBCT, went through the porcelain crown. All right. Excellent. Patient was very happy. She went home with her partner. Happily.